limbic system. And we said that the limbic system is very, very complicated, convoluted, and illogical part of the brain. So understanding that part of the brain is very, very difficult unless you are very good in going through this complexity of the limbic system and the brain system. So we have to understand the unconscious motivation for those patients in order for us to understand why he is depressed. Remember with Samiha, we said the reason why she became uptight is because her limbic system have a lot of registration from old trauma that is coming up in feeling very depressed. It's not very easy for the patient to let you go through their limbic system. Their limbic system is very precious. And unless you know how to go to this part of the brain, you're not going to be able to treat this patient well. The most important things in psychiatry is to understand this patient. And that's why you really need to be a good psychiatrist, no matter what your specialty, because to understand patients, you really need to get here in that limbic system. If you go in the thinking brain, it's very easy and you're not going to get much. So when the patient comes and says, I am depressed, it doesn't mean anything. You need to go deep inside the brain to see where is the depression is coming from. Because we all have a lot of feeling, a lot of emotion. Remember, 90% of the brain activities are deep inside our brain. We are not aware of it. We don't know what's going on there. The psychiatrists have to be very, very skillful to go and see where this feeling coming from and why you are acting this way. And what is your impact of your unconscious mind on your level of activities. So when we have anxiety or panic attack, it's coming deep from inside our brain, deep from the limbic system. If we don't know how to learn, or if we don't know how to exaggerate or take out this feeling or understand this feeling, the patient will internalize this feeling and he will have a lot of what we call GI symptom, migraine, because, the feeling inside the limbic system here in the red has to be expressed by the frontal lobe. If the frontal lobe, what?
Assalamu alaikum.
You understand? You hearing me well?
Dr. Ali, they're basically asking, is there a PowerPoint presentation that you would like to share?
Yeah, share it with everybody.
No. I mean, for the second lecture, you're not sharing your screen. So it's just the vocal lecture.
Oh, I'm sorry. I tried. I thought I shared. 1 second. Share screen. Is it shared now?
No, not yet.
Okay, let me see. Share. Now?
Yes, now it's shared.
I'm glad you told me. Okay. So it's all clear now? So here, we said we have here the limbic system in this red area, and the limbic system had a lot of feeling, and we said the frontal lobe is the one part of the brain that express those feelings. If we were not able to express those feelings, we usually internalize those feelings in GI symptom and physical symptom. And this is what we're going to see in the psychosomatic lectures. So always psychiatric interview is about getting to know this 90% of the brain activities that causing us to act this way. Why we are anxious, why we are depressed, why we are crying, why we have this feeling is because we have something deep in our unconscious brain that causing us to act in a certain way. So we need to know what is driving our emotion. The driving of our emotion is what caused our problem here. So, for example, the reason why we feel happy, like this guy feel happy, this guy feel sad, this guy feel angry, this is so elated, is because they have different feeling in their limbic system that is causing this certain feeling here. We need to understand how to look at the frontal lobe, but also to understand how to look at the deep and emotional limbic system to see where this feeling is coming from. And we're going to give you some example of that later on. So in psychiatric interview, we're going to collect information from the frontal lobe, like the patient say, I feel sad, I feel depressed, I'm not sleeping. All of that is in the frontal lobe. Then we have to go deep in the unconscious mind here, the emotional part of the brain, to understand where this emotion coming from, why this feeling is happening, and how we can learn about those feelings, which is driving his emotion. So the driving of the behavior is the emotion that is deep inside our limbic brain. So we have to act like a detector, a guy who understands, like a policeman who will know every detail, so we can know what is the small detail that causing this certain emotion. As you know, there is part of us we are not aware of it. For example, there is in everybody, including me, there is part of things like 1/4 of my feeling is known to me, and everybody around me know it. There is some certain things I know about myself, but nobody else know about it. And there is something that people know about me, but but I don't know about it. And there is part of me that I don't know about me, and none of you know about me. So this is where psychiatry need to work on finding this part of me that I'm not aware of it and make me self-aware of that behavior. So this is the role of psychotherapy, to understand what's going on deep inside my unconscious brain and why I am acting this way and how I can deal with this behavior. For example, this lady is a marathon runner. Let's name her Tina. Tina is a marathon runner. When she came to the office, of course, we never ask her why she is a marathon runner, but we just, she said, I'm a marathon runner. But we know that our behavior is always related to deep something inside our brain. So Tina, apparently, the reason why she decided, of course, this happened after therapy. The reason why she decided to be a marathon runner is because she had very traumatic event in her childhood. When she was 5 years old, she was raped by some family member. And what she told us is the reason why she was raped, because she was not quick enough. He was always faster than her. And then when she grew up, her unconscious mind taught her that she need to be fast. So she became a marathon runner. That doesn't mean that every marathon runner has been abused as a child. No, but all of our behavior, what drive our behavior, is always something might not be aware to us. We might not know what's going on, but it's deep in our unconscious mind that caused us to act this way. And Tina will not share this information with us because she buried deep in her unconscious mind. It takes a long time for us to reach this traumatic event that Tina encapsulated in her brain and will not let anyone touch or see about. So with psychotherapy and with good interview, with good relation with Tina, so we can trust her and she trusts us, she will reveal this information to us slowly. So that's why the patient want to tell you things, but you need to do it at his own pace. You don't force Tina to tell you what's going on. You need to let Tina on her own volunteer this information to you once she is able to trust you. Because if you try to tackle this traumatic event quickly, then you might lose the patient. That's why a lot of the patients come to you and never come back. Why? Because you must have touched on some bad memory that the patient doesn't want you to know right now. He wants you to know later, but not now. So leave it to the patient, not to your own timing, to the timing of the patient. So 3 components of psychiatric interview. First of all, you have to have good rapport with the patient. So always good handshake, how are you, smile, show good facial expression. Then ask him, it's nice to see you, have a comfortable seat. Let's talk about what's brought you here. Then allow the patient in the first 10 minutes to talk freely. So usually at the first 10 minutes, I just shake hand with the patient, have a seat, and then I don't say anything for 10 minutes. Let the patient express his feeling in this 10 minutes. Because this 10 minutes in the first part of the interview, the patient will reveal a lot of things that making him anxious or very concerning to him. So this is how the patient start freely talking. Then after that, you start collecting information about the problem. Let's say I'm not sleeping well, I feel sad. And then you ask about when did you start feeling sad? Tell me more about your sleep. Tell me about your wife, your social life, your behavioral pattern. All of this come back later. And then during this, you will notice that the patient will start talking in intensity about something important in his life. Like you noted that his financial problem is the issue, or a problem with his wife, or problem with his love affair. All of this, you will know which part to concentrate on which part is not important for this patient. And then you need to know what is the patient saying, and not only this, and how the patient is saying those. For example, if he say, I feel depressed, but his affect does not show that, then you have to be concerned. Or if he doesn't have any high emotion, for example, some patients, when they talk about the wife and the kids, they feel, you see emotion in their face. So that means those people are very important for them. So you need to see the intensity of that emotion, not only what he is saying, but how he is saying them, and is he coherent or going all over the place? So he is not very coherent in his presentation. A lot of the patient will start crying. So always the first thing you need to have in your desk is a box of Kleenex. So the patient, when they cry, you give them some tissues. And you always need to go deep inside the brain to see about what's really hurt in kind of love relation. So first, introduce yourself, greet the patient by his name. How are you, Mr. Flan? كيف الحال? How is life doing? All of that. Try to always let the patient sit, and always sit. I never interview a patient standing. Always sit near the patient or close to the patient. Why? If you are standing, the patient will not tell you anything. Why? Because when you are standing, that means you are in a hurry. And that's mean the patient does not gonna tell you a lot of things. We said you need to know deep inside his brain. He can tell you he is depressed or anxious, but you need to know exactly what's going on. So you need to go deep inside his brain, and that really need you to be comfortable and sitting and listening to him. And don't make any judgment. Like if he said, I love to drink, or I love women, or all of that, don't say it's haram and all of that. Just don't be judgmental for the patient. Just try to listen, and listen to the non-verbal behavior he had. Is he showing anger? Is he showing love? If he's showing some affect when he's talking. So we need to know the intensity of this affect and why they are coming and how they are coming. So first you ask him, what's bringing you here today? This is a good question after you introduce yourself. And a lot of patients will not say anything. But if you noted that they are a little bit anxious, so you comment on that, or you say, wow, you seem to be anxious today. Tell me more about that. Or you seem to be sad. Something must have happened. Or I'm glad you are happy today. If he's elated, I'm glad you are happy today. Let's share this happiness with us and all of that. So, and the most important things is to listen very carefully to the patient. If you don't listen, you need to show the patient that you are listening. So always try not to interrupt with iPhone or computer or anything, just to try to listen. There is a book called Art of Listening. If you don't listen to the patient, he will not trust you and you will not be able to help him. Sometimes one word from you can make a lot of difference in the patient, for the patient's life. So always try to be a very good listener. The most important advice for any psychiatric patient to give you any information is to trust you, because trusting you is very, very essential for him. He will not let you go to the limbic system unless you show that you are listening to him. We said we want to go to his limbic system. We're going to go to his feeling and emotion. We don't want to go just to the frontal lobe. We're going to go deep inside his limbic system. And that's very sacred place for the patient. He will not let anyone go there unless he really trusts them. So we really need to listen to him carefully so he can let you in his most significant part of the brain. Then when you listen to him, the patient understand that you are really want to help him. If you don't listen and you are working on your iPhone, then the patient know that he is not going to benefit from your session. Always ask about what called free-floating anxiety. Free-floating anxiety is what make you, like when you sit in the pillow at night, or when you sit on your desk and eating lunch or looking at the ceiling, what is things that come to your mind? Most of us will worry about our job, our work, our family, wife, husband, all of that. So this is what you call a free-floating anxiety. Try to learn, what is going on in his free-floating anxiety, what is really occupying his brain. Like in the last couple of weeks, probably a lot of us free-floating anxiety about coronavirus and COVID and scary and vaccine. So try to see what's going on, and because this is really what is the limbic system doing here. The limbic system, remember, always fire all the time. We're going to go to the limbic system by listening to the free-floating anxiety. Remember, limbic system fire does not sleep, fire all the time, day and night. So sometimes really you need to get to the dreams. So if he volunteered about the dreams, you ask him about the dream. Not all patients will share their dreams with you, but a dream used to be called by Freud. Freud used to say, interpretation of dreams is the royal way to the knowledge of the unconscious mind. So really to understand what's going on in the unconscious mind of the patient is really sometimes the dream will tell us a lot about what's going on with him. You remember, a dream does not tell you that you're going to be rich. A dream is not about the future. Nobody knows the future but God. We don't have the ability to know the future. This is only in God's hand. A dream's interpretation is really to teach you what is going on in your brain that is really making you anxious right now. Is the anxiety. The dream is about what's really occupying your mind right now, what you are anxious about. I'll give you an example. 12 years ago, I came from America to Riyadh, and this is me. I used to have a brown hair, I'm sorry. And then when I was in my dream, in the last couple of weeks before I came here, I was so stressed out and anxious. So I used to have a Lexus. This is my car when I was in America. And every time in my dream, my Lexus become a camel. So it doesn't mean that I'm going to have a camel here. It doesn't mean that camel means you're going to be rich or camel going to eat something. It just means that if you want to interpret this dream, that means Ali is anxious about moving to Riyadh, and his brain is not happy that he's moving from America to Riyadh. So you are going from very advanced university to back to Riyadh, a small hospital. So you are going backward. So the unconscious mind is telling you that you are going backward. But the unconscious mind does not communicate directly with you. So he said, your Lexus will become a camel. That means you are moving backward. The brain doesn't like you to go backward. The brain wants you to go to advance, to go forward. So my brain at that time, of course, I'm happy that I came here, but my brain at that time, my unconscious mind, my limbic system, show me this camel. So my car become a camel. Why? Because it's showing me that I am very anxious about you moving here, and so it will not tell me I'm unhappy with you or happy. It's just showing me that my unconscious mind is very anxious about coming here. So it moved my Lexus to be a camel, which is, we say the dreams are illogical and limbic system are illogical, but limbic system give you a great hint about what is bothering you right now and what is the anxiety right now. So this is how we interpret dream. Not we tell that you're going to have money or you're going to have a wife or you're going to no. The dreams is about what is in your anxiety in the unconscious mind, and that can give you a lot of information about the person. But I usually don't ask the patient what is your dream unless he volunteered to me. So chief complaint, history of the present illness. Let's say he said he's depressed, so tell me about your depression. If you don't sleep, tell me about your sleep, how long it has been, what is the stress in your life, do you have any pain, Did you lose your job? All of this aggravating factor of mental illness. And what make you better? For example, I always ask my patient, tell me about a good day in your life and what make you feel happy in that good day. So most of them will say food, medication, social interaction, woman, whatever. Associating factor, have you been hospitalized? Have you been using drugs or alcohol? Have you ever had manic symptoms? This is very important. And try to get more history through this. And always there is 2 questions you need to ask any patient. If you don't ask, you're going to fail in the exam. Remember this, always put it in your mind. 2 very important questions. If you don't ask, you're going to fail in the exam. Even if you do a great job, you need to ask about suicide and alcohol abuse, alcohol and drug abuse. Always, every patient who come to your office, you ask him to these 2 questions. Have you ever thought about ending your life? Have you ever thought about killing yourself or anyone else? And have you ever experienced drugs or alcohol or all of that? Very, very important question. Always patient need validation. So when he sees something that I graduate with honor from high school, wow. So always validate his feeling. Don't brush it off. Like this lady here, I lost my toy, and her mother is really teaching her a horrible lesson. You lost your toy, who cares? You know, her toy is more important than your Mercedes. So always validate her feeling. Well, honey, I'm very sorry that you lost your toy. Let's try to find it or find a way to deal with it. So always validate the patient's feeling. Always start with an open-ended question. So don't ask the patient, are you depressed? If you ask this, you will fail in the exam. Always ask him, how do you feel? Don't ask him, do you sleep good at night? No, ask him, tell me about your sleep. Tell me about your childhood. Tell me about your father. Tell me about your depression. Tell me about the feeling of low energy. Always don't ask any question that end up with yes or no or short answer, because that will tell the patient that you're really in a hurry and you don't have time to him, and he's not going to get you, he will not let you go into his limbic system. So sometimes you can ask him if you see some intention. Most of our intention is going to be about wife and money and all of that. So always ask him, well, you seem to have some trouble with your wife or something happened with your wife. Tell me, how did you feel when your wife moved out? And then you don't ask him, did you feel bad when your wife moved out? No. Tell me, how did you feel when she did that? Tell me, how did you feel when you do this? Tell me, how did you feel? Tell me means open-ended question. You want to know more about the situation, then you're going to get to his limbic system. For example, I give you an example. Jack is one of my patients long time ago. He's a 30 years old depressed male, and we used to see him like 7 o'clock in the morning in the clinic. I used to wake up early at that time and go see the patient. So we saw him for several times, and he said, Dr. Ali, do you live close by? Because you seem to see me always early in the morning. So do you live close by here or you live far away? So of course, psychiatrists also don't answer the patient because if I answer him, it will be a disaster. So my answer will be like this. Always you want to know why this patient is asking this question. So if I told him, yes, I live close by, it will end the situation. The patient will not tell me anything. So the answer was, I told him, Jack, that's a very good question. Tell me, what is going to make a difference if I live close by or if I live far away? And Jack said, you know, Dr. Ali, because I want to get here in this limbic system. He said, Dr. Ali, you know, if you live close by and you come here, that's mean I doesn't mean anything for you. I'm just a patient. But if you live far away and you come all the way just to see me, that's mean I mean a lot for you. I said, okay, so tell me about that. So when I told him, now I'm trying to get into his limbic system. Tell me more about that. So he started crying and he said, you know, when I was a kid, nobody cared about me. Nobody told me I love you. Nobody cared about my feeling. You are the only one who is asking me this question about my feeling. So this is the first time I see somebody who really, something for them. So then start crying, and now he is trying to invite you to go to the most secret place in his brain where he want to tell you about his real feeling, his pain, his agony, his tormenting things from early childhood. The patient usually don't volunteer this information easily. So if I told or if I answer his question, yes, I live close by, he would have not told me all of this. So that's always, you answer the question by a question. This is how I do. Tell me more, what do you mean by this? Or tell me a little bit about what does it make difference if I live here or I live close by? And then the patient will open up to you. Let's see if you ask him how I can help you today, and he said it's not specific, not about anything. This means we call vagueness. And when the patient is vague, that's mean he is not going to let you go into his limbic system. That's mean he's not interested. Probably his wife brought him to the clinic and he doesn't want to see you, so he's just coming. So this is not going to help. So don't go with the vagueness. Tell him, I need to know specifically what's going on here. But let's see, some patients will say, you have to ask my wife. So I asked one patient, how I can help you today? He said, no, you have to ask my wife. So here, if you ask his wife, you will destroy the situation, because it's about he said, she said. What he said that, always with the projection, he is projecting his problem into his wife. So here, don't ask his wife, even if his wife's there. Just tell him, like, one of the way I deal with it, well, it seemed like there is some issue here. Let's talk a little bit about your wife, so you can try to open him up a little bit. Because always, a lot of the patients will try to distract you, like, ask my wife brought me here, or the lawyers told me to come. So he want to throw it on someone else. But you need to refocus the patient and deal with his projection and try to get to the real problem by asking him about him. So you see, where is the intensity? If he had a lot of hesitancy in talking to you, try to engage the limbic system by, okay, well, it seemed like a wife has something to do with the situation. Let's talk a little bit more about your wife. So you don't want to discount the patient, but you want to, go with his flow, but at your own pace. So don't tell him, no, I'm not here to talk about your wife. You are bad. No, tell him, well, go with his flow and tell him, like, you really... it's very interesting that we're going to talk about your wife, and let's see, tell me how is your wife with you and all of that. So you stay on the same wavelength with him, because we're not focusing on what's really hurt the matter. In general, don't ask any questions, start with why. So never ask any patient why you are depressed, because the patient doesn't know why he's depressed. And probably you are not going to know why he's depressed, or why you are feeling bad, or why this happened. The patient doesn't know why. Why is in the logical brain. We said the patient is not in the logical brain. The patient is in the limbic brain, and the limbic brain does not have a why. It's very convoluted and it's very complicated. And even if he told you that I am sad because I lost money, he's sad not because of the money. If the patient tell you go north, you go south, it's different. The unconscious mind is different. So always it's like you are dealing with an ocean of a problem. Like John here. John came because he felt helpless and hopeless and depressed because he had prostate cancer. So when he came to the clinic, he said, I am depressed because I have prostate cancer. But that's not why he is depressed, He said, I have prostate cancer. Then he felt, I have difficulties in the last couple of weeks, and I'm not sleeping well because of my medical problem. I have prostate cancer, and, I wish to give up. And then he feels silent. Then now we need to know where is really, because prostate cancer is not dangerous cancer. It should not make him this depressed. So what should you do next? Try to understand this feeling of sadness is coming from somewhere. Try to tell him, okay, tell me more about that, or tell me more about these difficulties. Tell me a little bit more. And then John nodded and he said, really, is the prostate cancer, and I'm worried about my health, but I'm worried more about my wife. What's going to happen to her after I die? So here where is the red flag? So the guy is not worried about the prostate cancer. He's worried about his wife and what's going to happen to her after he died. So apparently, John loved his wife. That's good. So, and he is worried about her. So the issue is here is not the financial problem, it's not the prostate cancer. The issue is the main, or we call in Arabic, Beit al-Qasid, is his wife. He's worried about the welfare of his wife. Unless you understand this and you keep on the prostate cancer and the financial difficulties, John is not gonna help you much because he will not tell you a lot of things. You need to know about the red flag that making him real painful. And always it is the kids and the wife that really matter for any human being. And this is where most of our pain and love is for those people around us, our family. So nowadays, we're also going to see what is the most things that really matter for him. And a lot of these patients, talk about the traumatic event in their life. And now all of us are traumatized with the COVID virus. Why? Because it came and it lasted for a long time, especially if you are a kid and you have any traumatic event. Any traumatic event happen in the childhood is going to last forever in your brain. Why? Because your brain under construction. So anything happen during this period of time is going to stick with you and is going to last forever. It's going to stick in the memory. So always ask about a traumatic event in the patient's life, especially those traumatic events that happen in early childhood when the brain is under construction. Anything happen to you from 2 years old until 15 or 16 or 18, that is very traumatic, like death of family member, financial difficulty, sexual abuse, anything disasters happen is going to impact you for the rest of your life. So always ask about the childhood and what happened in the childhood. And then go with a train of thought with the patient. Don't cut the patient, do bridging. For example, if the patient is talking about something that's really bothering him and you want to move out, then do something we call a bridging. Bridging, that's mean try to keep with the flow, but move it to the other subject. Like he's saying, I'm not sleeping because I am depressed and my wife is doing this and I cannot sleep. Then you're going to bridge that and you can tell him, well, a lot of patients, when they have depression and anxiety, usually have trouble with the sleep. So tell me about your sleep. See, I'm bridging, I'm trying to ask my question, but I don't want to lose his train of thought. So I try to go with the flow, but then by using his own word, then I move to a different subject if I ask him. Or, for example, I'm depressed, I'm not sleeping, and all of that. So I tell him, if I want to ask about suicide, for example, so I tell him, you seem like you said, I'm using his own word, you said you are depressed and you are not sleeping. And usually some patients, when they have trouble sleeping and feel depressed, they try to commit suicide. See, did that ever happen to you? So here I'm trying to move with the flow, but I'm asking my question without interrupting his strength or his train of thought. And then I will try, if he mentions something good, then I will comment on that. You said like you were able to finish high school quickly and you were an honorary roll. That must be very, very important for you. Tell me more about that. So I'm trying to get his strength and make him aware that I'm listening to him and going with his flow. And we said always don't ask why. Never ask why. For example, let's see a patient came and he said, well, I lost my dinosaur. Well, that dinosaur this is 5,000 years ago when my grandfather was having a dinosaur. So reflect on those emotions. For example, I tell him, why? You lost your dinosaur. That must be a very traumatic experience for you. Tell me more about that. See, I'm here. I'm trying to identify with his feeling. I'm going to try to see how this losing of his favorite dinosaur caused him all of this agony and pain by showing him that I understand that feeling, sympathizing with his feeling. I will not shrug it off and go and ask him about something else. So this is what we call reflection on the emotion. And always say, I am sorry. Like if he said, I lost something or I lost some money or lost family member, always say, I'm very, very sorry to hear that. Don't shrug it off. Always say, reflect on the emotion. Always say, Well, losing somebody you love is very hard. I'm very sorry to hear that. Tell me, how did that make you feel? See, I'm reflecting on his emotion. Never say خلي إيمانك قوي or make your feeling of God is great, because this is very, very attacking way of dealing with things. Don't tell him I understand, because you really don't understand. Or don't feel bad. No, it's okay to feel bad. It's okay to cry. It's not, don't tell him don't feel bad. Yes, feel bad. It's okay. It's a feeling. We cannot control our feeling. Don't say this is the worst word you can see. It could be worse. This is not good, because you don't know what is the meaning of this loss for him. Let's see. For example, you lost your dinosaur, or you lost your Lexus for me, but you still have your camel. This is not a good way to deal with it. Maybe the Lexus is more important than the camel. Maybe his dinosaur is the most important things for him. So don't do that. You lost this thing, but you still have this. This is very bad way to deal with the situation. So this is to avoid. Don't, always establish good relationship with the patient, but be careful with the boundaries. Never hug a patient. Hug is not good. Even if the patient try to hug you, try to get away from that. Don't make any love relation with your patient. Respect the boundary. You cannot, this is what you call boundary issues. You need to read all of this. I'm not going to read it for you. For example, don't tell him, a lot of the patient, like a female patient, will say, Dr. Ali, it's really very hard to talk in your clinic. It's crowded, a lot of people. Can we go to Starbucks and talk over a cup of coffee or cappuccino or mocha? No, you don't take any patient to Starbucks. You don't go to dinner with any patient. It either he is your patient or your friend. You cannot be my friend and my patient. Remember this. You have to keep close boundary. It doesn't mean that he is your enemy. No, you have to be friend with him and like him and show respect and show some likable and love for him. But it's always have to have, like in our profession in America, as a psychiatrist, you cannot even marry. Let's see, if I have a patient I love and I want to marry her. You cannot marry her. If you marry the patient, you're going to lose your license. Even regular marriage, you cannot do that. You cannot marry your patient. You cannot have any relation with your patient. You cannot go to Starbucks or, any restaurant, McDonald's, Burger King, wherever. You cannot do this. Always keep strict boundary between you and your patient. I still remember one of my students. I was his attending, this is 20 years ago, and he was a resident, 4th year resident in psychiatry, 4 years. 5 months from now, he will be a board certified psychiatrist. And he made a mistake by going with the patient to the garden, to the park. The patient was very stressed out. She told him if she can go for a walk with him in the garden so she can express her feeling to him. The stupid guy went with her to the garden or to the park, and they have a walk and they have ice cream. And then the next day, she came and complained that he did that, and he was immediately punished by taking away his license. All of the 8 years of medical school and 4 years of residency was wiped out. He was stripped from his license. He was not allowed to practice medicine in the United States after that, just because he went with his patient to the park. You cannot do that. They have, especially psychiatrists, they have very strict rule about the boundaries. Boundary is very, very important. You are not to eat lunch or Starbucks or any box with your patient. Let's go here, to a case where I really seen, we talk about her in the first session. We said it's called Story of Beth, David, and Jennifer, how we can approach that. So Beth is a 28, she's now 29. I'm just kidding. So she came for therapy. She said for the last 5 days, she was not able to eat or drink and not taking care of her kids, not able to relax, very shaky, very nervous, tremulous, agitated. The problem is she found that her love her husband, David, sent a romantic letter to somebody named Jennifer. And after that, she was so confused, so angry, so agitated, not able to sleep. So here, she's angry, ruminating, cannot imagine he did this. So here, she told me that she is stuck. She cannot think. Why? She cannot think because what happened is the limbic system hijacked the frontal lobe. Remember that? So when you are stressed out, you cannot think and you cannot do anything. The patient will tell you, I feel stuck. Feeling stuck means I'm not able to do anything. My limbic system hijacked my frontal lobe and I'm here. I am a piece of problem. I cannot handle it. So the patient here comes with crisis. And here we really need to be careful about approaching this anger, sadness, disgusting feeling. She is in a crisis. You need to straighten out her feelings, straighten out her behavior. And what you need to do to balance her feeling, because her frontal lobe is not working, unable to understand what's going on in her life. So here, her frontal lobe, which is supposed to balance those feelings, could not, because it was jammed by the amygdala, which is hijack the frontal lobe, which usually try to make us understand what's going on. So what happened is we need to help Beth connecting the dot, taking the feeling from the unconscious mind to the frontal lobe so we can make her self-aware of what's going on. We need to straighten her thought and help her deal with the problem. And in dealing with that, we found out that the reason of the problem is about 10 years ago, before that happened, Beth was David's secretary. She was his secretary. He had a big company. And during that time, David was in love with a lady named Jennifer. Jennifer was very bad lady. Laoub means not good lady. And his family will not let him marry her, but he loved her a lot. But his family would not let him marry her. So he got into crisis and became depressed, and he was unable to work, and his brain could not function. So Beth came and helped him and ran the company for him and saved him. And then he loved her and he married her and have 3 kids. But what happened is here in the unconscious mind, what happened is David feel of Beth like his mother. Why? Because unconsciously the love was still for Jennifer. Jennifer is the real love. Jennifer is the one that bring David up to life. Jennifer is the one that he really loved inside his heart. He loved Beth a lot, but he loved her like his mother because she saved him. He married her because she saved him. So this is what you call the transference. Transference is how we look at things indifferent. So for example, the unconscious mind feel of Beth as a mother, but he still have a vacancy in his heart, need to be filled, and only Jennifer was able to fill that. So every couple of years, he tried to send Jennifer an email, and Beth will go all over the place and kill him for that. So we need to make Beth and David understand what's going on. So we explain to Beth that you need to act like a wife. You don't need to act like a mother. So you need to show him how to be a wife, how to connect with him, how to make him feel like you are needing him, not to show that you are like his mother, do this and don't do that. So this is what you call transference. And transference is very common things in psychiatry. Transference is very, very common. It happens in every situation. So we have positive transference, negative transference, and counter-transference. So positive transference is when you have a patient who really admire you, and a lot of my patients feel like they like their father. So they have to have a transference to me so they can understand me and listen to me. So the first things in psychotherapy and interviewing patient is to have some transference. That means the patient will like you a little bit, like you have always to dress good and be in good shape, so the patient will take you as a role model, like you are his savior or his father or his important idol, that he will look up to you and listen to you. If the patient doesn't like you, you're not gonna help him. And there is negative transference where the patient hates you or reminded him of something bad, and then the therapy will not be good. And there is counter transference where you have a feeling about the patient, reminded of something you hate, and then you hate the patient. For example, Adam here, Adam is a son of a father. His father is a doctor. So he is his son. And his father being a doctor really is bad. Don't tell anyone. The kids of doctors are always, bad kids. We always have something we call son of doctor syndrome, where really his father was very critical of him. Always do this, very demanding, perfectionist. You have to do this. You have to make A. You have to do that. You have to do this. And Adam does not like his father. So Adam got sick and his father took him to see a doctor. So immediately Adam had transference and he felt the doctor is like his father. So he felt very uncomfortable with his doctor. Why? Because he had negative transference, reminded him of his father. And this is all unconscious. So Adam is not aware of it. He cannot think about it. It's very deep in his unconscious level. And we said our father, being a doctor, we really concentrate more on the cortex. We don't have a lot of feeling as a doctor. We are always reading textbook and making our cortex great. We are not concerning much about our emotional feeling. Here we go. Julia's mom, Julia, when she was a child, she always talked to her mother, and the mother always said, I cannot deal with this. Just stay away from me. Julia now, when she go to see her therapist, she had another transference. She feel like the therapist does not have time to deal with this. And she hate to talk to her therapist because she is scared that her therapist might not have time to deal with her. Why? Because she learned that from her mother. Her mother used to tell her, I don't have time for this. So Julia now always feel like her therapist will not have time to deal with her. So this is what you call therapy problem and need to work on it. This is deep in the unconscious mind. This is what we see all the time in real life transference. Like a lot of the patient, when the wife scream at the husband, there is always bad relation. Always when the wife scream at the husband and the husband scream at the wife, we unconsciously remember that the one who used to scream at us is our mother or our father. So, for example, if your wife scream at you, you immediately hate her. Why? Because she will remind you that of your father when he used to scream at you, and you didn't like this about your father, so you immediately have a problem with your wife. So screaming always bring negative transference in the relation between the husband and wife. So always I teach my patient, don't scream at one another. Screaming will bring all the feeling and transference about the negativity of early childhood. So always ask about the childhood and always ask about, tell me a little bit more about your childhood. And we said, if you do not have a lot of relation with your mother, if your relation with your mother is very bad, then the orbitofrontal cortex, the part of the brain that make you self-regulate, make you impulse control, will not be matured. So all of these patients who had insecure attachment, that means they did not bond with their mother when they were a child, they grew up to be extremely anxious, unable to soothe themselves, and extremely agitated because they cannot deal with the life stress. And we said if you have a traumatic childhood where your parent used to fight all the time, that will give me an idea that you are a very anxious person. So always part of the interview is to ask about childhood. Let's see, if your father was critical, this is very bad sign. That means you're gonna grow up to have social phobia. So tell me about your relation with your father always. Or your mother. If the mother is not necessarily screaming at you, but she is a cold mother. You know, having a cold mother is a lot worse than having a critical mother. Because the cold mother, it will be traumatic for the kids. Because mother is our first object relation. So if your mother is very flat and not interactive and sad all the time, you're going to grow up to be very scared and you're going to have a problem in relation with other people. Why? Okay. Yeah, this is the last slide. Because you are unable to connect with people because your mother did not connect with you in the first place. This will spill over other relations. I think they are telling me the time is out, and we still have the second part of mental status exam. So please read it, and we'll talk about it later on in the next few lectures. Thank you very much, and ready for the question.
Thank you, Dr. Ali, so much. Your lecture is very interesting. So I have a few questions here. So is it okay if we accept gifts from patients?
Well, no. And last week I got a gift from a patient. He gave me a gift for $500,000 and I turned it down. One of my patients gave me a gift for $500,000 and I turned it down.
Wow.
So you are not allowed to get any gift from any of your patients. The most I can get is like less than 50 riyals. So I get tamar, na'na al-Madina, daqqat al-Madina, and what else? Chocolate and sometimes honey. But that's it. You are not supposed to take any gift from your patient.
Okay, thank you, doctor. Another question is, if you avoid their hug, won't that affect them negatively?
No, you need to let them in advance know that it's really, you're not going to get any hug from any patient.
Okay, and 1 second. Is it possible for the amygdala to become desensitized to recurrent negative stimuli over time?
Yes, and that's what happened to people who use hashish. Hashish is the one that really killed the amygdala. That's why people like the hashish, because it makes them have no feeling.
Doctor, sorry, hashish as in marijuana?
Marijuana, yes.
Oh, okay. So, doctor, something else. How do they help people who have problems with anger management?
Anger management is related, we say, to early childhood where you did not have connection with your mother, or your mother was very cold, your prefrontal cortex did not happen. So medication, we give you medication to help with that. We give you SSRIs. So medication will help with that, and psychotherapy and cognitive behavioral therapy. We try to teach you how to deal with the anger.
Okay, doctor, one more thing. So, doctor, if someone's mother did not care for them, etc., I'm sure there's a way that these, like, the individual could help themselves. Like, every person that they were distant and cold with their mother, they turn out to have anger problems, etc.
No, not everybody who did this. See, in psychiatry, there is not 1 + 1 = 2. But usually, what we see very common if you do this, it will be common. Like if you take 200 people where their mother take care of them, and 200 people where their mother did not take care of them. So in the 200 that their mother did not take care of them, we will see more patients with social anxiety. So it's one factor, but there's many, many factors. But this is one of the most important factors.
Nice. Doctor, is this why, patients with lobe lesions, they become anxious and angry all the time?
Yes, because the frontal lobe is gone. Frontal lobe is the one that make you calm and help with you. I'm sorry, we didn't do the whole lectures. We still have 2 hours to go. And this is a 4-hour lectures. I have to do it in 1 hour. I'm very sorry, but I will I will do it again for you.
Okay, doctor, how can someone become emotionally intelligent?
Well, this is what we're going to talk about probably later on. If you can read the marshmallow trial. See, the problem really, I'm about to get mad now, because really I need to explain all of this to you, but we didn't have time. My enemy is time. Give me 2 more lectures, 2 more hours free. I don't need any money for them. Just let me teach you all of this. Call Dr. Yaqinuddin and tell him, please do 2 more rescue lectures for Dr. Ali, so I can give you all of this information.
Okay, doctor. Yes, I will most certainly do that.
No, there's a lot of things I cannot explain it to you unless we do a lecture about it. So, and it's really, psychiatry is so important, and I always ask for more lectures, and they don't give me.
No. That's unfortunate, because honestly, this was interesting. So, Dr. Bess, if you don't mind, I have 2 more questions.
I don't mind. Give me as much question as you want. And give them my phone number so they can send me any question on WhatsApp, please. You have 2
Okay.
days to send me a question on WhatsApp. Any question, send me on WhatsApp. Just send me the question. Don't send me إشراق الصباح ولا قبل المقفع ولا قبل التاني.
Okay. Okay. Another question is, females have a more complicated limbic system. Does that mean that they're harder to control themselves?
No, women are more pragmatic than men. That's why women are much emotionally smarter than men. The woman really their limbic system is unbelievably complicated. It doesn't mean it's very hard to control it. When they have high emotion, they will cry easily because it's way too much for the frontal lobe to express those emotions. So that's why they have very, very good limbic system. The reason why we don't have good limbic system as a male is because testosterone is what kills all of these connections. If you want to read more about it, there is a book called The Female Brain. It's free on the internet. It's called The Female Brain. It's explained all of this. So initially, when we are born, we have the same female. When we are 1 month old in our mother's womb, we have the same brain, male and female. Then at age 2 months, the male brain has surge of testosterone that kill most of the social emotional connection in the brain. And then at age 14, during teenager years, we have another surge that kill 80% of the social emotional feeling, what left of that. So we really have nothing compared with female in terms of social emotional connection and emotion.
Wow. Doctor, okay, just one final question. Okay, so is it healthy to try? No, not that one.
Go ahead, ask any question. I have until 9 o'clock, so don't worry.
Okay. Yeah. So if someone asked if the frontal lobe can't understand, does the amygdala take over?
Yes, this is what happens when you are depressed, when you are anxious. The frontal lobe is not working, and the amygdala. I have a very good example, and it was supposed to be shown to you. It's there in the slide, so I will try to explain it to you.
Okay, is that for inshallah next time?
Next time.
Okay, and thank you, Dr. Ali. And one thing is, what is the reason for rumination?
Rumination is coming from the goat. The goat eat and then throw the food out and then eat it again. So rumination is the role of the amygdala. The amygdala always try to ruminate. That means bring things from the past and keep doing it all over again. Why I did not have this? Why I did not have this? Why I lost my dinosaur? Should not lose my dinosaur. The amygdala keep ruminating about what happened to you in the past. This is typical of depression. In anxiety, the amygdala keep ruminating about the future. Am I going to have enough time, enough money to buy my Mercedes and my camel and all of that? So this is what happened in amygdala and rumination.
Okay, thank you, doctor. That was the last question that we have for today.
Okay, so I'm going to try to make up for the previous slide in the next lectures. But if you can, please, can you make the lectures like instead of 60 minutes, 70 minutes? That will help me a lot.
I will most definitely talk to Dr. Ahmed Yaqinuddin about this.
Yeah, because I really, the psychiatry is so, if I go fast, you will not understand me.
True.
So I am one of those who will go a little bit slow so you can build up and understand. I don't want to be a regular teacher. I'm one of those who want to do it on especially when it's not person to person. I hate Zoom.
Yeah. I agree. Thank you, Dr. Ali. I will make sure to talk to Dr. Ahmed. Thank you so much. I will, just before you guys leave, I will send you Dr. Ali's number so that you can send him if you have any further questions.